Cigarette smoking has been identified as the main cause of preventable disease, illness, and premature death in the world. Every year, smoking-related diseases claim an estimated amount of 443,000 American lives, including babies born prematurely of smoking mothers and victims of secondhand exposure. Smoking costs the United States over $193 billion in 2004, $97 billion in lost productivity, and $96 billion in direct health care expenditures, and an average of 4,260 per adult smoker. In 2010, the Midwest and Southwest regions, the pink regions, have the highest prevalence of adult smokers. Utah has the lowest percentage of adult smokers with 9.1%. Cigarette smoke contains over 7,000 chemicals, and 69 of the chemicals are known to cause many types of cancer, such as lung cancer. These cancer-causing chemicals are known as carcinogens. About 8.6 million people in the United States have at least one serious illness caused by smoking. From the photos here, the hazardous effects of smoking can be seen. The common smoking-related diseases are chronic obstructive pulmonary disease, coronary heart disease, stroke, lung cancer, oral cancer, throat cancer, cervical cancer, kidney cancer, stomach cancer, and pancreatic cancer. Cancers can appear in many parts of the body, such as larynx cancer, oral cavity cancer, esophagus cancer, lung cancer, bladder cancer, and pancreatic cancer. Smoking is directly responsible for approximately 90% of lung cancer deaths and approximately 80 to 90% of COPD deaths. For every person who dies of a smoking-related disease, there are 20 more people who suffer from at least one serious illness associated with smoking. They may be your children. To change in the future is in your grasp.
Among current smokers, chronic lung disease accounts for 73% of smoking-related conditions. Even they quit smoking. Chronic lung disease still accounts for 50% of smoking-related conditions. Smokers die significantly earlier than non-smokers, 13.2 years for men and 14.5 years for women. Comparing men to women, women have a greater reduction in lifespan. In 1990, almost 55% pregnant women smoked. In 2005, 10.7% of all women smoked during pregnancy. Healthcare costs attributable to maternal smoking have been estimated at $366 million per year, or $704 per maternal smoker. Smoking while pregnant accounts for about 20% to 30% low birth weight babies, up to 14% premature deaths, and 10% of all infant Deaths. Secondhand smoke inhaled by non-smokers is classified as a Group A carcinogen, responsible for 3,400 lung cancer deaths. It is also responsible for 46,000 heart disease deaths annually in non-smoking adults. Smoking by parents is associated with many conditions in their children, including severe asthma, sudden infant death syndrome, and the increase in frequency of colds and ear infections. In 2009, an estimated of 46.6 million, or 20.6% of adults were smokers. Males have higher rates of smoking prevalence than females. 23.5% of males smoked compared to 17.9% of females. In 2009, non-Hispanic whites had the highest percentage of smokers, which was 22.2%, followed by non-Hispanic blacks at 21.3%, then Hispanics with 14.5%, and the lowest were the Asians at 12%. Smoking declines among non-Hispanic white population. Tobacco companies have targeted both non-Hispanic blacks and Hispanics with intensive advertising. In 2006, the advertising cost of the five major tobacco companies totaled 12.5 billion. Quitting smoking is the single most important step a smoker can take to improve the length and quality of his or her life. The American Lung Association has many options to help adults and teen smokers quit smoking for good.